Good to go? Well, good afternoon. On this first anniversary of the first COVID-19 vaccination that we gave on the Gold Coast at the Gold Coast University Hospital last year, it's wonderful that we could announce today a further easing of restrictions. Queensland has done such a great job of managing this virus for over 2 years now, and particularly the wave of Omicron that we have faced since we started opening the borders last year. Today we have announced that masks will be eased from 6 p.m. on the 4th of March. This date of the 4th of March is in line with the school plan that we set out to allow 4 weeks of the school year with these restrictions so we can manage any outbreaks within our schools. We believe that we can now make that decision, that we can lift these measures both in our schools and our communities at the same time. So that will mean that masks will not have to be worn indoors, in schools, shops, cafes, pubs, restaurants, shopping centres. That includes staff and patrons. But we still will require masks to be worn in vulnerable settings, so in hospitals, disability, aged care settings, in corrective facilities and youth detention, and in high-risk settings such as public transport and airports and on planes will continue to require mask wearing. Now, in lifting the mask wearing, we want to make it clear that people should carry masks with them in situations where they believe they might find themselves in crowded areas where they can't socially distance and they want to feel more comfortable, or they're particularly vulnerable and they believe it's appropriate they wear the mask. Anyone can wear masks anytime, anywhere, and as a community I hope that we respect the right of people to still wear masks even though the mandate has been lifted. We also reserve the powers to implement the mask wearing again if we see a significant spike, and that includes as we go into our flu season. We are lifting density limits in relation to funerals, and there'll be no limits in the number of people who can gather in your homes as well. In lifting the school plan from the 4th of March, it means that school excursions can start again, assemblies, visitors to schools, and importantly those face-to-face parent-teacher interviews. Our schools will continue to have rapid antigen tests available for students or staff who become unwell during the day and need to be tested, and of course all the other COVID-safe measures as far as cleaning, workforce planning, good hygiene will continue to be operational at our schools. So this is a great day to be able to move to this measure. When it comes to mandatory vaccines, because I know I'm going to be asked that, we will continue to watch closely what happens with our cases, and we will regularly be updated by the Chief Health Officer as to when we can move to lifting of further restrictions, remembering that the only restrictions we will now have after the 4th of March is the mandatory vaccination, both for workers in certain industries and patrons, and also the requirement to isolate and quarantine for 7 days at a time. Again, I thank all of the health workers who have been involved in our vaccination rollout. Of course, that continues, and I particularly call on parents with children from 5 to 11 and also 12 to 15-year-olds to come out and get vaccinated, and also for people who haven't had their booster shot yet to also come out and get boosted. But I'm thrilled that we have seen over 3.8 million Queenslanders get at least one vaccination here in Queensland. We want to continue to see those numbers increase. I'll now hand over to Dr Durrant.
So thank you, Minister. Sadly, we have 5 deaths to report today, 2 people in their 60s, 2 in their 80s and 1 in their 90s. 1 person was not vaccinated, 1 had received 1 dose of vaccine, 3 had received 2 doses and none had received a booster. 1 was an aged care resident, and our thoughts are with their families. Patients in hospitals are beginning to fall again slowly. We're down to 380 in public hospitals in the last 24 hours, down from 384 on Monday. We have only This includes just 30 patients in public hospital intensive care units. They're down from 34 on Monday. And in our private hospitals, we're down to just 14 patients with COVID-19, down from 17 on Monday. The numbers of school-aged children diagnosed with COVID-19 is up a bit in the last 24 hours to 1,967, which was up from 1,360 yesterday. Similarly, the total number of reports of COVID-19 in the last 24 hours was up a bit, was 5,583 cases, up from 4,114 on Monday. I wouldn't read a lot into a single day's reporting. A lot of this, interestingly, was self-reported rat testing, and we wonder whether the increased availability of rat testing means we're getting more reports through, because I think all of us are aware rats are now easily available in retail outlets. So I wouldn't read too much into those increased numbers on that day. I tend to focus more on the hospital inpatients, which continue to decline. With regard to the events coming up on the 4th of March, this date was chosen because this will be the end of the Omicron pandemic wave for all regions of Queensland. This will enable us to relax the measures, as you've heard, particularly focusing first and foremost on mask wearing. And if we don't relax mask wearing, the mandates now, then when else would we do it? I think this is the right time to do it. But I do want to say a couple of things about the mask wearing. We're now all used to it. So if people want to wear masks, particularly in crowded environments, they should do so, and they shouldn't feel awkward about doing so. We're all used to this now. So particularly if you're in a crowded environment, I plan to carry a mask with me at all times whenever I'm out in the city. Also, particularly if you're vulnerable, if you're older, please don't hesitate to wear a mask if you want to protect both yourself and to protect others around you. The other thing is we are expecting there to be some sort of secondary wave in the coming months, probably in winter. I think that's been stated over and again. We don't know what the future will hold, but we assume there will be some sort of wave in winter. How large it will be, we don't know. There is a significant chance we will need to introduce mandatory mask wearing at some point, for a limited period. And I guess the point is, when we say that mask wearing is mandatory, that means that it's really necessary, that we really need to do it. So now that we're at the end of the wave, now is the time to relax those measures. But if and when we do say that mask wearing is mandatory, we want people to take that seriously. I'll now hand back to the Minister.
The government this week plans to extend Australia's hours by 6 months. Given we're coming to the end of this wave, can you just explain why we need this?
Sure. And many of the powers that we put in place, the temporary powers for other agencies, will cease at the end of April under the current legislation. The ones we are extending are predominantly the public health powers and the powers of the Chief Health Officer to still make directives. As I said, we've travelled very well through this first wave, but we don't know what's coming. We've just opened up international borders. Only yesterday. We are now going to lift the mask mandate. We need to wait and see whether that will lead to new cases coming in, potentially new variants, and we need to still be prepared. So if need be, if we need to put in place mandatory mask wearing, for example, we've got the head of power to do that. So it is just sensible to ensure that we extend these powers, knowing that the safeguard is that the moment that as the Health Minister, I can no longer satisfy myself that there is an emergency declaration that needs to be in place, that declaration needs to be lifted. And once it does, irrespective of the extension of this legislation, all of those public health directives will cease to have force. So there is a safeguard there, but I'm not aware of any jurisdiction in Australia that are lifting their public health powers at this stage, because to do so at the end of April, and we've only got till the end of March to actually initiate any extension because of when the sitting weeks fall, it would be very irresponsible, and I wouldn't want to see us have to race back to Parliament to try to introduce a head of power so that we can take measures to keep the community safe.
Are you expecting to then extend the health emergency runs out at the end of March? they expect to step up?
Again, I'll take advice on that, but it is highly likely that I would be seeking for the Governor to extend that again.
Minister, what are the density limit changes?
So the density limits, there's a range of settings where they're for unvaccinated, where there's density limits. They will ease as well, but we have very limited density. I think the most important one I wanted to emphasise today was around funerals. There has been density limits in relation to funerals that we believe we can now move to remove that and allow as many people who want to attend a funeral to be able to do that.
Where is actually going back to go to venues? Is that a state or a national cabinet?
It is a state decision.
Right, but that's still in place, right?
It is still in place. We think, again, based on health advice, it would be irresponsible to lift all of the remaining restrictions at once. To allow us to lift them on the 4th of March will allow us to see what impact both international arrivals have in the next 2 weeks and then what lifting the masks do after that. We'll continue to review this on a weekly basis, but we have to see what trends occur over particularly the next couple of 2 to 4 weeks, I would think, to see what's happening.
Fully vaxxed, 2 or 3?
2.
How many people are locked down today?
I would have to get that number for you.
And so for weddings, are there changes there? Like,
No, so the requirements around wedding numbers has not changed. Yeah.
Just
So
from
what is the change with the wedding one then? Is it uncapped?
There isn't a change on the weddings. So if there's unvaccinated people, there wasn't a density limit. It was a number of attendees. So that cap. Yeah, I think it was 20. The cap remains on that at this stage.
Just on the vaccine mandate, so you said you're looking at new variants and what happens with the masks coming on. So do you expect to make a decision on that in a couple of weeks once we have a clearer understanding?
But again, we're watching these numbers daily, and we will continue to observe what's happening here in Queensland in the number of cases, hospitalisations, the number of cases in children, particularly. Interestingly, as the Chief Health Officer said, the majority of our positive tests that we're reporting today are from rapid antigen tests. However, of the PCR tests, I think there was around 5,000 PCR tests in the last 24 hours. We're looking at around 1 in 5 people still showing up positive who are coming forward with symptoms. That's still a pretty high rate of the virus in the community. Now, the good news is majority of those people never need any medical treatment or hospitalisation, and that's because of our vaccination rate. So we'll just take it cautiously, carefully. I've seen what Victoria's announced. I've seen what New South Wales has announced. I think we're very much in line with what other jurisdictions are doing. We'll continue to work with the sectors around the mandatory vaccinations, but at this stage we believe we're best to continue to do this in a staged approach.
Have any decisions been made about childcare centres requesting RATs for staff?
So there's discussions. So the discussions we've had with the childcare sector in relation to rapid antigen tests is that staff and parents of young children will be prioritised at any of our public testing clinics. I think that's a reasonable measure, and I believe it was welcomed by the stakeholders. I was part of those discussions. As far as the broader provision of rapid antigen tests, they are more readily available now, and like many other industries, we would expect that sector to procure their own. But if there is a staff member or parents of young children who find themselves unwell and need to get tested, they can go to one of our clinics and be prioritised either for PCR or a rapid antigen test.
how will the daily COVID updates work going forward?
So we will, excuse me, we will continue to report them through our websites and social media on a daily basis. So people will still see how many new cases we have, how many of those are rapid antigen tests, how many tests we've done, and sadly, we need to continue to report the number of deaths of people who have tested positive for COVID. So we'll do that daily, and beyond that, we will certainly be reporting when there is any sort of circumstances that would warrant additional information being provided to the community. But we are in a really fortunate position that we can now move from standing up every single day reporting on this information to simply reporting that online for everyone to see and learning to live with COVID more throughout the community.
Is that for next week?
Yes.
Yeah.
Yes, last couple of questions now.
Given that, as you said, about the concern in this way, do you think that the state needs to do dedicated quarantine facilities still?
I think the facilities at Wellcamp will be a good tool to have in our toolkit for managing patients going into the future. We don't know where this pandemic is going.
Can I ask another call for to revisit daylight saving? Do you think it's time for another referendum on the issue, or is it dead?
Oh, look, that's a decision of the Premier, but there's no discussions in government that we have another referendum. That referendum's been had.
Next, why is the North West Hospital Health Service still under control of the administrator?
Because we're going through their recruitment process at the moment, but I've given an undertaking. The administrator has issued a report to me that says that they believe that a board can be established and should be established. There was various options available to us, of course. I heard the comments of the member for Traeger in the Parliament today. Can I be clear that the reason why we needed to abandon the board is that we could not get sufficient numbers to have a constitutionally formed board that have the expertise that are needed. So based on retirements, resignations that I had at the time, the numbers that were left and the number of people who had applied for positions just were not going to allow for a board to be sustainable. And there were issues that were raised, and the report I've received from the administrator backs up it was the right decision to do at the time. I'm very pleased, however, that the decision, the advice that's been given to me is a board should be re-established. There is a recruitment process going on currently, and I look forward to announcing the new members of the board in the near future.
Just on daylight saving again, so do you think people should give up talking about it?
Oh, people can talk about whatever they want and people can advocate for what they want, but right now this is not a focus of the government, it's not a priority. We have listened to the people of Queensland who have previously said they do not want daylight savings, and we're just focused on growing our economy and dealing with our response to COVID.
Thanks, guys.
Thank you.
Appreciate it.
Thank you.